Mental health problems begin at any age, really. You can develop them as an individual during your childhood or your adulthood, or even as you become an older adult or quite elderly. They can develop at any stage. What's probably more significant is that they develop at a time when you're under quite a lot of stress or there's quite a lot of change in life. So they're the conditions that are likely to lead to the increased chance that some mental health problems will develop. Mental health symptoms don't normally come on suddenly. Normally they slowly emerge and become greater and greater, more present, more obvious for the person who's starting to struggle. And there can be quite a few signs that develop over time, and the individual would be aware that things are becoming a bit more difficult or a lot more challenging over time. And also people near to the person, people that live with the person, family members and friends may also notice some of the changes in the individual as well. So they're unlikely to develop in a very quick way. For most people, say with anxiety, depression, or other types of common mental health problems, they develop rather slowly, unless somebody has been unlucky enough to experience some trauma, some accident or injury, and then there can be mental health problems as a result of that. It's more obvious what the trigger was or what the conditions were that led to that mental health difficulty developing. Some of the signs of mental health deteriorating would be a change in sleep. Maybe somebody is starting to sleep more than normal or less than normal, or sleep is becoming more disturbed, maybe more nightmares, broken sleep during the night, maybe waking up earlier in the morning, that kind of thing. Maybe they're starting to look after themselves a bit less well. Maybe they're washing a bit less frequently, turned out in terms of clothing or appearance, looking a bit more disheveled maybe, or just not taking as much effort over themselves, not taking as much care over themselves. Maybe their mood is starting to drop. So maybe they're more pessimistic, more negative about things, more bleak. Maybe they're starting to worry about things that they wouldn't normally worry about, getting concerned about things, anxious about things, or they're withdrawing from people, not going out so much, not responding to people's messages, people's phone calls, not doing what they would normally do. So these are types of things that we can recognize in ourselves, if that's happening to us, or in other people as well, friends or family, the people that we care about. We might notice a change in what they're doing or in how they're describing things that are going on in their life. So over the last while the COVID's been with us, we've seen quite a few changes in people in terms of their coping. That things become more difficult to cope with. There's the threat for a lot of people of COVID. There's a lot of bad news out there about COVID, the risks. Unfortunately, a lot of people are contracting it, becoming unwell and passing away as a consequence. So, that's a real concern for people. And for people who are prone to anxiety or at risk of becoming anxious, then COVID is providing a lot of opportunity to become anxious, to become worried, to check for symptoms, to check into the doctor, to search the internet for answers. And often when people start doing that, it can become more and more worrying because there's uncertainty out there about what they might be experiencing and how COVID's going to develop generally in the population. So anxiety loves uncertainty. It generates more anxiety if there's more uncertainty, and the COVID context is certainly providing some threat, some uncertainty, and has increased both the amount of anxiety that anxious people are experiencing, but also it's creating anxious people for the first time, really, or significantly anxious people for the first time. So following COVID, people are quite often reporting symptoms like increased levels of anxiety, increased levels of depression, so becoming more worried about things, more anxious, but also that their mood is lower. There's also symptoms like brain fog, that people are experiencing some of the more long COVID symptoms like heart palpitations, chest tightness, tingling in the fingers, and additional symptoms are things that aren't usual for people. And when we experience those, we try to work out why we're having them, what's going on, how long we will have them for. And that provides quite a bit of worry. You know, we worry as a consequence. We don't feel great. We want to feel like our normal selves. We're concerned about the impact that this might have over the long term. How long might it be around for? How it might develop, that kind of thing. So both the symptoms during COVID, the symptoms that people have in long COVID, and concerns that people might have generally after experiencing COVID can create some significant psychological challenges for people, definitely. It's very important that people do their best to look after themselves generally. And if you notice a change in how you're feeling or how you're behaving or how you're thinking, then it's important to be curious about that, and to think if it represents that you're struggling a bit more, that some of the changes recently are having an impact, and maybe you could do with leaning on some friends, some family, or seeking out some professional support, because quality professional support exists. There's a lot of evidence-based help out there that can help a lot. And it's important that people don't isolate themselves and become a bit of an island when they're struggling, that they reach out to people, professionals or non-professionals that can offer assistance at that time, and that they then can bounce back and feel better sooner rather than later.